Hmm. Okay. What is his number? Okay. Staphylococcus, gram-positive cocci, arranged in clusters. So cytoplasm gets stained, not the bacterial cell wall. You have to write neatly, like bunch of grapes. Okay. Staphylococcus, gram-positive cocci, arranged in clusters. They are arranged in clusters because daughter cells daughter cells fail to separate out mother cells, and they divide in all planes and look like bunch of clusters. So grapes means in Latin staphylo. Staphylo. Okay. So coming to the cultural characters, how they grow in the media, depending on the growth on nutrient agar, enhancement can be done by nutrient agar and milk agar. Aureus produces golden yellow color pigment, golden yellow. Albus produces egg white. Citrus lemon color, lemon orange color. So 90% of Aureus are pathogenic that cause infection in man. 90% of Staphylococcus aureus produce infection in man, and they also produce complete zone of hemolysis around the blood agar. Blood agar they produce beta hemolysis on blood agar. They produce beta hemolysis on the blood agar. They produce beta hemolysis on the blood agar. Now coming to the virulence factor, the ability to organism to colonize, infect, and cause infection in human being. The virulence factors are they produce enzyme called coagulase. They produce enzyme called coagulase. Coagulase is an enzyme which is produced by pathogenic staphylococci, which cause infection in human beings. Coagulase is an enzyme produced by pathogenic staphylococci. It converts fibrinogen into fibrin. It converts fibrinogen into fibrin and forms the wall around the organism. Fibrin barrier. Fibrin barrier around the organism, so that organism gets protected. Organism. What you are talking? What nonsense is this? In front of sitting here in front of talking what is it? Huh? Fibrin barrier around the organism, which protects organism from phagocytosis. There are two types of coagulase. One is free coagulase, another is bound coagulase. There are two types of coagulase, another is free, another is bound coagulase. The free coagulase is tested by doing slide agglutination test. You take emulsion organism and add plasma, and there will be clumping of the organism. There is a clumping of the organism. Tube coagulase is bound coagulase. Sorry, this is to test bound coagulase. Free coagulase is tested by taking in test tube 0.5 ml of broth culture, adding 0.5 ml of 1 in 10 diluted plasma, 1 in 10 diluted plasma, incubate at 37 degrees for 4 hours, and look for thick coagulum at the bottom of the tube. Thick coagulum at the bottom of the tube. The difference between free coagulase and bound coagulase is free coagulase requires the help of CRF. What is CRF? Coagulase reacting, not central reserve police, central reserve force. It is coagulase reactivating factor. Coagulase reactivating factor. So this is to detect coagulase. Coagulase is important pathogenic factor. It helps the organism to protect itself from the phagocytosis. So other toxins produced by Staphylococci are, they produce hemolysin that causes lysis of the RBCs, leukocidin which kills leukocytes, leukocidin which kills leukocidin which kills leukocytes. Leukocytes are white blood cells. They kill leukocidin, and hemolysin lyses the RBC, and very important, it produces enterotoxin. Entero means it acts on the gut. It is responsible for food poisoning. Enterotoxin, which is helpful, which helps the organism to produce food poisoning. Now, and there is an exfoliative toxin, enterotoxin, exfoliative toxin, which produces superficial skin scalded syndrome, which is responsible for the superficial skin scalded syndrome. So, in totality, the important pathogenic factors that are produced by Staphylococci are: one is coagulase, second is hemolysin, third is leukocidin, fourth is enterotoxin, fifth one is exfoliative toxin. Exfoliative toxin. These are all the toxins produced by the Staphylococcus aureus. Now, where do you think this organism is present in the nature? Can you guess anybody? Staphylococci is present in, where is it present? Staphylococci. Anybody guesses microorganism where the Staphylococci is present? Any guesses? Anybody in the class? Where the Staphylococci is present? In the hospital, in the laboratory, or where the microorganisms present? Microorganisms. Where the microorganism present? Where the microorganism? Where are the microorganisms present in the nature? They are like God, ubiquitous. Present on the roof, present on the floor, present on the table, present in the hand, present in the mouth, everywhere, hair, everything. In fact, human being carries more number of microorganisms than his DNA itself. Trillions and trillions of microorganisms. Every area of body is covered with microorganisms. Am I right? Okay. Where do you guess where this microorganism is present? Human being is a walking, talking museum of microorganisms. Human being is a walking, talking museum of microorganisms. Can you guess where microorganism is present? Any ideas? Guesses? No. They are present in the nasopharynx. They are present in the nasopharynx. Hold it like this, nasopharynx. Nasopharynx. Okay. Now, when you do a local survey of local nasopharynx, you take and isolate the organism in the culture media. 10% of if you do a survey of Kuppam, if you go to the market area and catch hold of 10 people and do the nasopharynx swab and put it on blood agar, only 10% carry. When it comes to hospital personnel, healthcare workers, nurses, doctors, surgeons, laboratory workers, microbiologists, it goes up to 40%. Nasopharyngeal carriers, it goes up to 40%. Goes up to 40%. How much? 40%. If you do a survey of 100 people, 40 people will be carrying Staphylococcus in the nasopharynx. How much? 40%. When you do a local, other than the hospital workers, the people, vegetable vendor or local people, if you do a survey of 100 nasopharynx, only 10 people will be carrying Staphylococcus in the. So hospital is a very bad place. If the patient gets admitted, he will definitely going to get some infection. Some doctor will be carrying MRSA, methicillin-resistant Staphylococcus aureus, only treatable with vancomycin and linezolid. So hospital is, it is said that getting admitted into the hospital is dangerous than skydiving. It is said that getting admitted into the hospital is more dangerous than skydiving. So in Bangalore, most of the places there is a something called daycare center. If person needs an IV antibiotic, he comes to the doctor, consults. If he needs a necessary antibiotic, they'll put an IV line, take an antibiotic morning one dose and night one dose. So that's an end of it. Nobody wants to get admitted in the hospital. Hospital carries MDRs, multi-drug resistant microorganisms, especially MRSA. MRSA is called superbug, like Superman, Batman, any other, Bahubali, whatever it is, Pushpa, whatever it is, fire. Okay. Pushpan is not flower and fire. Okay. So, so it is very, very important to know about Staphylococci. Staphylococci will come across in your clinical practice when you become doctors. So it is very important organism. One of the it's one of the hospital bugs, especially MRSA. It's called as hospital bug. So it is very risky to get admitted in the hospital. That's why we have what is called as infection control, national accreditation board for hospitals. Hospital should be clean, neat, and free from microorganisms. It's not possible because all the patients who comes will come with some sort of infection. It's not US or where they have almost conquered the infective material. They all suffer from cancer, autoimmune disorders, and all those things. To see tuberculosis, typhoid fever, there's exchange program going on between US and India or London and India. They come to India to see malaria, tuberculosis, leprosy, filariasis and all this. So India is a hub for all infections. Why? India still weak, day in, day out. What is it? We are overpopulated. See, in this small room, we have so many people. We are too many small people. We are 1/5 of, geographically 1/5 of America and 5 times, population wise, 5 times. US population is 35 crores. Indian population is 135 crores. And US is 5 times bigger than India. Geographically. India is 5 times smaller than geographically than US. So how distant people are staying each other. So here If you one fellow person in sneezes, he give prasadam to all the people in the class. Just one sneeze, all the people can get it. So hospital staphylococcus is very important. It is called. What are the people who are susceptible for this infection? Any wounds, they get infected. Surgical wound. People on ventilator. Ventilator is not this ventilator. So someone was asked, an NMC inspector asked, how many ventilators you have? Oh, our hospital is fully ventilated. Every room has got ventilator. Not ventilator. Ventilator is artificial breathing machine, life support system. So people with diabetes mellitus, and all these people, immunocompromised patient, burns, road traffic accidents, all these people will be infected with Staphylococcus aureus. So I said when person get infected, we have to suffix with ITIS. We have to suffix with ITIS. So it infects almost all systems of the body. Staphylococcus systems infects all the systems of the body. Now, most common infections produced by, you remember the Staphylococcus with ABC. In the examination, as soon as the student comes and sits across the table, what are the infections produced by Staphylococcus? Look at this. I read, sir. I forgot. Remember ABC, abscess, boil, and carbuncle. So all of you should carry a medical dictionary. Know what is abscess, what is boil, what is carbuncle. So all these things are very important for a medical student to understand the terminology which commonly used for the infection. Skin infections like boils, stye, abscess, carbuncle, impetigo. These are the wound infection, and it is infection of the surgical site infection and infection of the burns. Infection of the burns. In burns, people die of infection, not because of burns. Second week onwards, they develop infection, they die of burns. And one of the important causes of deep infection, bone infection, osteomyelitis. Bone is staphylococci. Infection in the bone is staphylococci. It produces in abscess in almost all organs. Take the deeper organs like kidneys, it produces abscess in the kidney, liver, brain, heart. And you take all respiratory organ, it causes laryngitis, pharyngitis, tracheobronchitis, tonsillitis, sinusitis, pneumonia. All respiratory organ, you add ITIs, respiratory infection. So it is one of the pyogenic cocci. It is the pyogenic cocci. It's one of the pyogenic cocci. It produces pus. What is pus? Pus is the end result of fighting between the microorganism and the immune system of body, neutrophils and the bacteria. It can be yellow, dirty yellow pus. It's the end result. Hold like this. There are toxin-induced 3 staphylococcal lesions. Very important lesions produced by toxins. What are the 3 important toxins? Remember as FTS. Food poisoning, toxic shock syndrome, Superficial skin scalded syndrome. Here it is due to the toxin. Here it is due to the toxin produced by the staphylococci. Here it is toxin induced by the staphylococci. Okay. Now, what is food poisoning staphylococci? The incubation period is very short, 6 hours. Incubation period is very short. It is about 6 hours. It's described as one of the scenario I'll give you. Nearest picnic spot about 46 60 kilometers from here. What's the picnic spot here? Huh? Malpuram. Mallapakonda. What is that? Balaji is there. Temple. Temple. Balaji temple. Hill station. How big it is? Hill station. Huh? Tiger waterfalls. Kaigal. Kaigal. Okay. Nice. Garden is there. So it is said that it is described as uh, the second year MBBS students on a March or April summer month going on a picnic to Kaigal, whatever it is, nearby picnic spots in the morning at around 10:30. Sadhana has prepared fruit salad with ice cream. Just a name, I mean, don't take. So fruit salad and ice cream she has prepared. So after in the morning, after seeing all those spots, you have a lunch. After that, you have a fruit salad and ice cream. In the evening, instead of doing recreation in the evening, playing tambola or some antakshari or whatever songs, and some people are good singers, some people are mouth organists, some people are guitarists, and all those things. Instead of enjoying that, you will end up in the casualty of Kupum Hospital, PS College Kupum Hospital, with diarrhea and vomiting. With diarrhea and vomiting. Okay. Once we had, you know what is Airbus? Airbus 777. Airbus 777. It can accommodate 777 people. Okay. Huge bus. So we thought it will be like a bus, BTS bus or KSRTC bus or APSRT bus. So once we have there was a flight from Delhi. In olden days, there was only Air India. There no other Indigo or Malaya flights or this Kingfisher flights were not there. So that flight was taking almost 4.5 hours, and all the 777 people were supplied with given fruit salad with ice cream on the board. So by the time they reached Bangalore, they left around 11:30, 12. By the time they reached Bangalore around 4 o'clock, instead of going to their five-star hotel or home, they ended up in casualty of Victoria Hospital, Bangalore, with diarrhea and vomiting. Okay, this is how it is described. Food poisoning is described as it's a short incubation period with 6 hours. It is due to the uh, poultry products. The most common poultry products it contaminates is milk, fish, milk products like paneer and cheese and all those things. Incubation period is about 6 hours, and it gives rise to vomiting, diarrhea, not much of fever. Okay, this is about food poisoning. Next is toxic shock syndrome. This is common in females, not in males. It is due to the contamination of tampons which is used during the menstrual cycle, and usually it activates the complement pathway, and there will be massive hemorrhages, and vagina gets necrosed. Sometimes death occurs, and it is also presented with. It is due to enterotoxin F. Enterotoxin are classified into A to F, A B C D E F. A to F. Enterotoxin F is responsible for food poisoning. Sorry, a toxic shock syndrome with massive activation of complement. Some people die of this. Next is superficial skin scalded syndrome. It is due to the exfoliative toxin produced by Staphylococci. Exfoliative toxin produced by Staphylococci. And it is very important. It looks like a burns. It looks like a burns with hot water. This is due to it's common in children, and so you remember toxin-induced staphylococcal lesions are three. One is food poisoning, short incubation period, vomiting, diarrhea. Tampon-induced toxic shock syndrome, and exfoliative leads to superficial skin scalded syndrome. Now coming to the laboratory diagnosis of staphylococci, laboratory diagnosis of lab diagnosis of staphylococci. Always you attempt in three. One, two, three. Okay. One is direct demonstration. Second is culture. Third is zero diagnosis. So these are the three steps in the diagnosis of bacterial infection. Three steps in the diagnosis. So depending on the site of infection, if it's a wound infection or burn infection, swab. How do you sterilize swab? Swab is sterilized in hot air oven. Okay, 160 degrees for 1 hour, 180 degrees for half an hour. Or it is taken, swab is taken, immediately you have to do, two swabs are taken, one is inoculated into, one is do a gram staining. What are the steps in gram staining? First, second, third, fourth. Four steps in gram staining. Gram staining. 4-step procedure. Gram staining. So just remember, only two stainings are there for 35 marks. Grams 20 marks, Zn for 30 marks, 15 marks. First step is violet, second step is mordant, gram staining, third step is acetone or alcohol, fourth step is dilute carbofuchsin. Everybody repeat. Gram staining is 4-step procedure. First step is methylene violet, crystal violet, junction violet. Any violet you can use. Okay. Any violet you can use. We use junction violet. Then mordant, which fixes dye to the cytoplasm. Decolorize with alcohol. Counterstain with dilute carbofuchsin. Okay. Gram positive look violet. Gram negative look pink. Gram positive look violet. This staphylococci looks gram positive cocci arranged in clusters. Gram positive cocci arranged in clusters. How the diagram I have drawn that. looks like bunch of grapes. So culture, you put it on blood agar, it shows beta hemolysis. Nutrient agar, you can produce pigment, aureus golden yellow, egg white, citrus, and coagulase test is done. Slide coagulase and tube coagulase test, then to find out the pathogenicity. Catalase test, hydrogen peroxide is poured with a glass rod. Staphylococcus is coagulase positive, Streptococcus is coagulase negative. So very important is Staphylococcus is drug resistance. They are, I said MRSA is only sensitive to oncomycin glynazoline. So there are different mechanism of producing drug resistance. One is very important is it produces enzyme called beta lactamase. This is beta lactam ring. It cuts the beta lactam ring, makes it useless, and it is a plasmid mediated. Staphylococci, it is plasmid mediated, transferred from one resistant bacteria to sensitive bacteria through a method of transduction. Through a method of transduction. Through a method of transduction. All hospital strain are have become resistant to penicillin. Beta lactamase breaks the backbone of the penicillin, and drug resistance becomes drug resistant to beta lactam antibiotics, and that is penicillin. And it is transmitted from drug resistance to sensitive by method of transduction. And another is there is inside the Staphylococci, there is alteration in the penicillin binding proteins. There is alteration in the penicillin binding protein. There is an alteration in the penicillin binding protein. And third thing, it will not, when you use penicillin, it becomes tolerant. It will not get inside the bacterial cell. So, very important mechanism of action is production of. So, we add beta lactam BLIs. Beta lactam with beta BLI. Beta lactam inhibitors. There are 3 BLIs: clavonic acid, tazobactam, one more, sulbactam. Or you remember software company TCS. Tazobactam, clavonic acid, tazobactam, clavonic acid, and sulbactam. Tazobactam, clavonic acid, and clavonic acid. So you must have heard a term called bacteriophage. Bacteriophage is a virus that leads parasitic life on the bacteria. Bacteriophage is a virus that leads parasitic life on the bacteria. It leads two kinds of life cycle. One is lysogenic cycle. In lysogenic cycle, the bacteria gets integrated. Bacteria gets integrated in the bacterial nucleus as a provirus. And another is lytic cycle. It multiply and lyses the bacteria. Prophage, it lyses the bacteria. It lyses the bacteria. Prophage, I mean lytic cycle. Lytic cycle you see in Staphylococcus. Everybody, lytic cycle you see in Staphylococcus aureus. Lysogenic cycle is seen in organism called Corynebacterium diphtheriae. So it is responsible for production of bacterial toxin. I mean diphtheria toxin. Diphtheria toxin. And it is transmitted from one bacteria, drug-resistant bacteria, to drug-sensitive bacteria through transduction, process of transduction, through a process of transduction. So what is MRSA? MRSA is methicillin-resistant Staphylococcus aureus. Methicillin-resistant Staphylococcus aureus. So the drug of choice for the treatment of methicillin-resistant Staphylococcus aureus is linezolid and vancomycin. Linezolid and vancomycin. Linezolid and vancomycin. Now, what is the use of doing vector fast typing? Where it is done? Do you think vector fast typing is done in PS Medical College, Gurgaon? Where it is done? Any idea? Anybody has read Staphylococci? No, no one has read. So, staphylococcal fast typing is done Maulana Azhar Medical College, New Delhi. Okay? MM, New Delhi. So, what is the use of doing fast typing in hospital practice? To find out the source of infection. So, you have operated about 5-6 cases on a particular day. All 6 people are getting infected with MRSA. 6 people post-operatively, they are infected with Staphylococcus aureus, which is methicillin-resistant Staphylococcus aureus. Now you want to find out the source from where they got, whether it is a surgeon who is attending it, whether it is a nurse who is attending it, whether it is a house surgeon who is attending it, whether it is a PG, MS general surgery who is attending, or whether it is a physician who is opining about wound who is attending it. All the or any ward boy or something like that who is preparing, nurse who is preparing the bed and all that. So we take a nasopharyngeal swab of all the people who are attending this patient, and we send it to the Maulana Azhar Medical College to compare the phage which I have isolated from the patient and phage of these people. If some nurse or some surgeon, the phage typing is same, then we said that surgeon is responsible for giving infection to this patient. So what we do, we have to treat MRSA carrying person, that is surgeon, nurse, or PG, or intern, whatever. We have to take 1 week leave, and we give him chlorhexidine bath. We put a nasal pack, mifuracin ointment, and we again re-swab until he becomes MRSA negative. Then we'll take back to his work. So this is in brief about Staphylococcus aureus. What is drug resistance, fast typing, what is coagulase test, what is the post-streptococcal toxin-induced staphylococcal agent like food poisoning, toxic shock syndrome, and this thing, all these things. Now we'll enact on small this thing. For example, Shanmugam.